Healthcare organizations face daunting investments of time and money to comply with evolving regulatory standards. It's tempting to focus on the quickest path to compliance, but lessons from years of conversion projects of similar scope suggest there may be better approaches. HIPAA, electronic transactions, and ICD-10 medical codes require training of people, redesign of operating processes, and significant IT investments. Given lower revenue over the past year and the need to contain costs, organizations must allocate scarce funds to implement healthcare IT and government-mandated compliance. And this means automating complex clinical, administrative, and financial processes. For healthcare providers and payers alike, this could spell real risk. But status quo is not an option. Many organizations are asking, what is the best way to define and execute a plan that minimizes service disruption, accommodates new realities, spreads financial investments, and lowers project risk? The shift to increased use of healthcare IT creates opportunities as well as challenges. The U.S. government has allocated over $36 billion in stimulus funds to drive meaningful use of healthcare IT. But organizations must invest an estimated $14 billion to comply with new standards. In addition to a focus on initial compliance requirements, organizations can develop strategies for improved operational efficiencies and ongoing innovation. This means flexibility must be an underpinning of any plan. An industry of IT service providers are ready to assist in these efforts. This adds to the confusion in the task, how should we assess and select a partner to assist our healthcare IT initiatives? Can one firm really handle it all? What are the critical elements within these projects that require special focus or expertise? History has shown that when tectonic shifts have driven transformation in other industries, data-driven execution that is focused on quality achieves higher project and even market viability. Every industry is unique, especially healthcare, but underlying principles do apply. Data can be analyzed to identify and reduce variations in quality, standardize on best practices, establish better business processes, and automate to reduce errors and improve efficiency. Data-driven analysis and decision-making enable organizations to execute and look beyond the immediate impact of the change to generate foundations for success. This approach enables organizations to leverage new compliance standards as a catalyst for analytics and business intelligence that enable data-driven decision-making for case management, disease management, utilization management, insured population management, and revenue cycle management. Since 1996, Technosoft has assisted organizations in multiple industries to modernize complex processes and systems and exploit new technologies or capitalize on new business processes. Our view is healthcare organizations can ensure a flexible transformation to the meaningful use of healthcare IT by adopting a component-based approach to each step in the journey. This allows an organization to focus on service modules that address particular stages of the implementation and configure components based on the areas of greatest need for adoption and desired outcomes. Modular services address priority implementation areas, including strategy development, data migration, testing, validation, and ongoing operations. We've developed a simple 3-level compliance model to guide strategy in this area. More detailed information about each is available on our website. Basic compliance ensures immediate results by meeting compliance deadlines to maximize reimbursements. Compliance Plus improves effectiveness with options that include the ability to leverage expanded data within core and data warehouse applications. Compliance Advantage adds improved analysis and business intelligence for data-driven healthcare IT that enable competitive advantage. During this time of significant change in the healthcare industry, it's important to emulate the attributes of past success with a focus on cost, quality, speed, and flexibility. If you would like to learn more about these ideas or speak with one of our experienced consultants, we set up a special section of our website for this important topic. Click here for more insight and practical advice from experts in healthcare IT, including best practices for payers, providers, and revenue cycle management.